There are a lot of myths associated with the flu. A common myth: you won't spread the influenza virus if you're feeling well. But in actuality, 20 to 30% of people with the flu have no symptoms. So today we're talking about some ways to ward off the virus with Dr. Seiler with Central Virginia Family Physicians. Take a look.
The flu is usually more severe at the onset. So you have higher fevers, higher aches and pains as far as you hurt more places, significant headaches, and usually a dry, raspy cough that goes with it.
Now, if you have kids in here, because I have a 6-year-old, and it's a lot harder to figure out how sick a kid is there anything that a parent should be looking for in a kid that possibly has flu?
Again, the same sort of symptoms, and also I look for how the child acts. Or, especially a younger child, are they consolable? Do they have any nausea or vomiting? Are there other symptoms that may lead you to think it's not flu? Could be a stomach virus or things like that. And also just the degree of how bad they are. Appetite, temperature. Is it a 101 temperature or 104 temperature? So try to look for some of that, and then try to figure out if they come into the office, do they have the flu or not?
Now, this time of the year, a lot of people go to work when they shouldn't. What do you suggest, and what kind of treatment options are there for the flu?
Well, certainly one of the best treatment options is to not get the flu in the first place.
Good point.
So all the primary care offices, hospitals, pharmacy centers are all offering flu shots. So always recommend people get their flu shot ahead of the flu season. If you get the flu, we do have many treatments now. And certainly if you do have it, you want to stay at home too for a period of 2 to 3 days at least to get over the bad symptoms, not expose other people to what you've got.
Now, when it comes to the flu shot, some people believe it makes them sick. Is there any truth to that?
Not that we found in the research, although I certainly have had my share of patients say the same thing. I just encourage them the next year to get the shot again and see what happens.
Time will tell. Now, let's talk a little bit about you. You're kind of new to the area, but not really. Tell us a little bit about yourself.
Right. I've been in family practice for probably close to 30 years and did my training up in Richmond. But while at school there, I met my wonderful bride who's from Lynchburg. So we've been coming back and forth here for over 30 years. And an opportunity arose where I'm now able to come back here and work in an office and also teach at the new medical or osteopathic medical school up at Liberty.
That's really exciting that they're offering that. And I understand one of your students is your daughter.
Yeah, she is, and very proud of her. And we have 2 other daughters who are at Liberty as well in school.
And just in general, talking about educating our kids these days, it's very important because we need more doctors, don't we?
Right. And the medical school up at Liberty is an osteopathic medical school, and the osteopaths are definitely geared more to the primary care aspects of family practice, pediatrics, general surgery. So it really is a nice complement to what Liberty's philosophy is already, and the staff and the faculty up there are just phenomenal, just a fantastic group to work with.
And let's talk about you over here at CVFP as well. What type of patients do you all see here?
We see the gamut. I mean, basically newborn till it's time to pass this world, and so it's fun and exciting. You shift gears quickly. Could have an older person with a lot of issues. Could have a young person come in right after them. So, and people are just wonderful. Most people want to get well. We try to help them with that and encourage them along in their medical health and education.
And Central Virginia Family Physicians has many locations in our area. For more information, 434-382-1125 or online at cvfp.net.